we've got an interesting show for you tonight. We're going to be reviewing how Viagra is used for female function, for men, and what impact it has on fertility. And we came up with this topic because a number of our clients were asking us about whether or not Viagra can help. And some people were saying they heard that it was harmful. So I thought I'd put together a presentation for you and we can review the data. And then, of course, as always, we'll answer all your questions live. I put up a post just over the weekend asking if anyone had questions, and I think we got about 60 or so questions. So if you go on our stories on Instagram, you'll see as many of your stories as I could get to answered personally. I tried to do some in text and some in video, but they're all there. So we're going to review this topic tonight. Hopefully it'll be of interest to all of you. Definitely some interesting information there that may help change how we do things. So buckle up and enjoy the ride with us tonight. So the main things I want to talk about are the various groupings or classifications of where this may be useful. So Viagra obviously has two target audiences. One is for women and one is for men. And obviously it was initially used for erectile dysfunction. But the question was, can this actually help improve the sperm quality in men that are using it, or actually be detrimental to the sperm quality for the men that are using it? And certainly we know that fertility can cause a lot of stress. And because of the stress, some men are not able to perform, or age may be a factor and they're not able to perform. So many of those men need to use some type of agent or device that will help them. And obviously Viagra, the little blue pill, is one of the more frequent agents that is turned to, along with Levitra and Cialis. So this isn't meant to target Viagra specifically, but it is the one that has been studied the most. So we definitely have our male target. And then in the female population, the question is, can it improve fertility and does it affect sexual function? So for men, we know clearly that it's very useful in helping men achieve an erection when they have erectile dysfunction. Less known is what the impact on the sperm is, and we'll review that with you tonight. For women, the questions are, does it help thicken the endometrium, which is something that's being looked at because it can help dilate your blood vessels and facilitate getting more blood to the uterus? Can it help improve your pregnancy rates because of its effect on the uterus? And there is some data as well showing that it can have immunological impact on natural killer cells in the uterus. And then finally, how does it work for women who are struggling with orgasm dysfunction or sexual arousal problems? Can it be helpful in that population as well? So someone said the fertility factor fiction is getting a little hot and spicy, and I guess this is the hot and spicy edition of fertility factor fiction. So we're going to start reviewing the data. So I figured I'd just start with the men since they're the primary target of Viagra and talk about the impact. So the question is, does it help with erectile dysfunction? And the answer is obviously yes, it does. It's been used for a very long time now. It is definitely the mainstay of therapy, along with Levitra and Cialis, for men that are struggling with erectile dysfunction. And that can be neurogenic, like from a spinal cord injury or a back injury, or it can be from diabetes and so on, or it can just be psychological, where you're having stress and it's induced, or just age. About 50% of men over the age of 40 have erectile dysfunction. So if you're in that age group and you have the added stress of infertility, it does take a toll on sexual function for men. So does it work for that? Absolutely, it does work for that. And the studies for that are abundant and clear. What impact does it have on sperm? So I pulled up a great new meta-analysis, and it's called The Effect of Phosphodiesterase 5 Inhibitors, which are all of these types of medications, on the treatment of male infertility, a systematic review. And this is brand new from October of 2021. It's in the the World Journal of Men's Health. And so they did a great review of the topic. So they analyzed 12 different randomized controlled trials, and they looked at the difference between people that were taking no therapy or placebo and the people that were taking the phosphodiesterase 5 inhibitors like Viagra. And the vast majority of them were Viagra, although not all of them were. Some of them had Levitra and some of them had Cialis. So they looked at the different parameters as per the World Health Organization criteria to see if it improved the outcomes. So when they did this, they analyzed it, and they have these great little sort of plots, we call them, to show what the outcomes are and how it improves things. So I want to run through all of that with you to go over it. So I'll screen share this to you. Are we up already for screen share? Yep. So if you want to screen share on, and just let me know that that's up and running. So if you look at the data there, I'll point out where the numbers are important for you. And I'll just circle it at the bottom. This is the total down here. And you can see that the evidence favors the use of Viagra for seminal volume. So if you're trying to build up more semen volume, you get a higher amount of volume if you're on one of these agents than if you are not on one of these agents. You flip to the next page and you'll see very similar findings again shown right here, where you're getting a higher sperm number or sperm concentration when you're using one of these agents. So you get more volume, you get a higher concentration. So then they moved on to looking at the specific sperm concentration per milliliter. And again, down here, you can see a little evidence there of, I got to erase that little line. It's a little tiny blip, and you can see that it's again favoring the use of these agents. So you're getting more concentration, you're getting more volume, you're getting more concentration per mil. And I'm looking at the totals. When they looked at the various different studies, some of them fall on one side, some of them fall on the other. But in a meta-analysis, you're going to pile all of these together and analyze it as a grouping. The final one is looking at how many of the sperm are actually moving. And you can see here, it's quite robust. There's a significant increase in the number of sperm that are actually moving. And that's fantastic, because that's helping not just the number of sperm, but you can have lots of sperm, but if they're not actually active and moving, you're running into problems with the quality of the sperm nevertheless. In this case, you're seeing improvements in the number that are moving, you're seeing improvements in the number that are moving quickly, you're seeing improvements in the count, and you're seeing improvement in the volume. So the overall outcome for men is showing that it improves your erectile function for sure, but it's actually beneficial for men that are taking sperm. Interestingly, they had less improvement for men that took it acutely, meaning they only used it episodically when they were trying to have intercourse. For men that were on this routinely, kind of on a daily basis, this was definitely showing more promise. So if you're taking this, you may want to look at the opportunity to take it on a regular basis, on an ongoing basis, rather than just once every couple of nights when you're having intercourse. Oh, share it again? Sure. Yep. It's still on sharing. So when we looked at the other studies for this, the next group obviously came back to women. So we know now that it's useful for men. So the question is this useful for women? So when you look at a study for women, they have a fantastic trial, again, relatively new, and hopefully we can screen share that with you as well. Is it available or not right now? Okay, you want me to try it again? Yeah. Hang on, we're just trying to get the screen mirroring to what? There we go. So when they looked at women, they broke it down by IUI and they broke it down by IVF. So in the group where they did it for endometrial thickness, they did show a statistically significant increase for both IUI and IVF for women that take Viagra to thicken the lining of their uterus. And there's actually several trials that have shown that now, demonstrating that if you take Viagra and you are undergoing treatment, you will thicken the lining. So do we have that up now? Yeah. So if you take a look right here, I'll show you on this little image, you can see that the endometrial thickness definitely increases and the amount was about 1 to 1.5 millimeters thicker. That can actually be a make it or break it moment for a lot of you who are struggling with a lining of 6, 6.5, 7, and need to really surge past that 8 millimeter mark, which is often our target. And in this case, you can actually do that by switching to Viagra. Interestingly, when they looked at patients who were doing intrauterine insemination, and this was the game changer I hinted about, you can see down here that again, whoops, it is statistically significantly increased in the women that are using Viagra for the clinical pregnancy rate. So they don't have live birth data here, but they are showing overall that you'll get an improvement in the rate of clinical pregnancy with just something as simple as IUI by taking Viagra for the woman, not the man, during their cycles. And so this was very, very kind of interesting data to see, what's happening with this group. They also showed the same thing at the bottom of that graph for the chemical pregnancy rate. So you're getting more positive betas, more positive heartbeats, and you can thicken the lining when you're doing this for IUI. So again, this is very, very valuable information. They found the same thing with timed intercourse as well. So we're going to start implementing Viagra into our IUI cycles now because it can assist quite a bit for women that are trying to achieve that benefit. And that's a huge change because you're actually seeing percentage differences in success. And with IUI, which has a very modest success rate to begin with, anything we can do to improve the chances is going to be beneficial. When they looked at IVF gets a little more tricky. With IVF, you're going to see that there is pretty decent endometrial thickness most of the time if it's a fresh cycle. And so when they looked at this with endometrial thickness, it actually just barely crossed the non-significance line, meaning it looked like it was trending towards being beneficial, but it actually isn't. So you're not going to see a huge increase in the endometrial thickness if you're trying to do IVF and it's fresh. With frozen, there are some studies that have shown some benefit, but then they've got some other studies that have shown no significant benefit. What about the clinical pregnancy rate? Same kind of thing. It's just coming up to that line of 1, which means that the confidence intervals cross 1. And if they cross 1, it means it's not significant. So you can see there that the confidence intervals are very close. And because of that, they did not see a significant increase in the overall rates. They also didn't see it when they broke it down by the frozen or by the fresh for the clinical pregnancy rate. The chemical pregnancy rate, however, just eked by in the total, and that's mainly because of the frozen embryo transfer rate, where it's just at the point of being positive. So these numbers are showing that your chemical pregnancy rate with IVF and using Viagra may actually be beneficial. So overall for women, you're going to see an increase in endometrial thickness during IUI cycles. You may or may not see it during IVF cycles. It's very highly sort of variable and depends on which study you're looking at. You will see a clinical and chemical pregnancy increase in IUI or timed intercourse cycles. But with the cycles that are undergoing IVF, you're only seeing a little bit of a benefit for the chemical pregnancy rates. There is a trend towards a higher clinical pregnancy rate as well, but it wasn't strong enough to say that it was a statistical significance. And so that's really important because that means we don't know yet for sure if it is beneficial or not. Certainly some data to suggest that it might be, but nothing concrete to kind of hang your hat on. The last part of this was another study that was relatively new, and I just wanted to kind of bring this to your attention for patients that have interest in doing frozen embryo transfers. I'll show you this as well. So I'll just show you kind of the title page here. Are we still on? So this is great. It's called Adjuvant Vaginal Use of Sildenafil Citrate, which is Viagra, in a hormone replacement cycle. So this is the majority of cycles people are using. Improved the live birth rates among 10,069 women during their first frozen embryo transfers. So this is really critical because these are people who are actually implementing this in their first try at a frozen embryo transfer. So when they looked at this, granted it's a retrospective study, so it's got lots of biases and issues. But if you look down here and I expand this up for you, you'll see that they did see a significant improvement. Their odds ratio adjusted after checking for confounding variables and so on in the group that had the Viagra was 31% higher for having a live birth rate. So this data is showing very robust positive outcomes in a large number of patients for a live birth rate. So that's really critical because that's the thing we're always looking for. The ongoing pregnancy rate was higher, 29%, and super interesting, they had a much lower 42% decrease in the miscarriage rate in the patients that were using Viagra as well. Why? Probably related to blood flow being improved. And as I mentioned earlier in the show, there do appear to be some very significant immunological changes in natural killer cell activity in the endometrium for patients that use Viagra. And we use it for some of our patients that have immune-mediated problems with their uterus. So this is really very, very important because it does look like it's a critical element of some of the things that we can see in the fertility patient population that's female, not just the men. So far we've figured out it's good for erections, it's very good for sperm quality, it appears to thicken the lining of the uterus, it's great for IUI, it may be helpful for IVF, and at least one study with a large number of patients is actually showing that for frozen embryo transfer cycles that are programmed, they actually did see an improvement in live birth. So very, very promising results. The last question is, does this help women who are having sexual dysfunction? The same stresses that occur for men also occur for women, probably much more so. And so there are women that are having a difficult time with the sexual intimacy portion of creating a baby. Fertility can often put a strain on your relationship. It creates an enormous amount of stress, and that can have an impact on your sexual function. And we want you guys all, of course, to be pregnant, but we certainly want you to have fun doing it too. And it should be enjoyable and intimate and pleasant and pleasurable. So can Viagra help you? So we, years ago, started using some Viagra-based cream, which we ended up calling Scream Cream for obvious reasons. And in this study, they used the actual pills for Viagra, but they did show, and it's in another study I'll show you here, which I have to kind of blow up on the page because it's too small to look at. But they have things looking at sexual orgasm, and they also looked at your sexual satisfaction and arousal. So I won't go through every single line here because there's lots and lots of it there, but on all three topics, sexual arousal was improved in women that had simple sexual dysfunction or sexual desire disorders. Sexual orgasm for women that did not have any kind of neurological defects was also improved. And if you've ever spoken to a woman that's used Viagra to help with orgasm, they definitely describe the orgasms as being explosive and really very impactful. I've got Tarek laughing off to the side here. And then sexual satisfaction was also improved. So all of these women that are using it are actually saying that it can very significantly improve their experience. So for those of you that are struggling, it's okay to tell us that and to say to your RE, look, this is really challenging for me on a sexual level. I need something to help me. And the response is we have something that can help you, whether you use a topical like Scream Cream or you use a pill, they will both work. The big issue in doing this for women, and I don't want to, talk about this without bringing up this topic, is that about 20% of you will end up experiencing a pretty bad headache. So that headache can be quite debilitating. And certainly if you have a headache, it's obviously the classic line, honey, I have a headache. It's probably not going to make you very amenable to wanting to have sexual intimacy. So, it's worth trying ahead of time to see how you respond to it. Obviously, if it's causing severe headaches, then that's probably not the right treatment or approach for you. You may want to try the topical treatment instead of the pills because the topical treatments likely have far less of a side effect profile, although we don't know that they work quite as well. There are no studies on the topical treatment for clitoral function that I'm aware of. So, sum total of all of this, does Viagra work for men? Yes, it improves your sexual function, but more importantly, it can actually improve your sperm and might be a way for us to help guys to improve their sperm quality. Is it because they're ejaculating simply more frequently, or is it actually the sildenafil or the phosphodiesterase 5 inhibitors improving the sperm quality? I don't think anyone will be able to tell you that. But the reality is, either way, as long as you're ejaculating more frequently, you're going to end up with better sperm. Does it work for women? It improves your endometrial thickness. So if you've got a lining thickness problem, it's worth a shot. If you're doing IUI, we're actually going to implement it into our protocol now because it definitely looks useful for that. And then if you're doing the IVF, there is a fairly strong suggestion that certainly with a frozen embryo transfer, you're going to see an improvement in your chemical pregnancy rate, and at least in one fairly large study, an improvement in the live birth rate, although this was not randomized controlled trial data. This was retrospective. In the randomized controlled trial data, we don't have enough information yet to say definitively, but it was definitely right at the margin. And so it gives me enough hope to say for patients that are struggling or they've had failures, this may be something we need to consider. So Viagra may be the solution for you, whether you're male or female, and it's not just for guys anymore. So